We mentioned at the outset of today's program that sponsoring organizations play a critical role in the launch of and the success of the National Kidney Donation Organization.
And that's especially true of the valuable guidance and support we have received from CareDX, the lead sponsor of this Volunteer Living Donor Advocacy Conference. It is with great pleasure that I introduce you to Dr. Peter Maag, Chairman and CEO of CareDX, your partner in transplant care.
Thank you very much, Ned, and a big thank you to the donor-to-donor team here from CareDX. My name is Peter Maag. I'm the Chairman and CEO here at CareDX, and I'm looking forward to introduce you to what we do at CareDX. We are a very proud presenting sponsor of this meeting, and so thank you very much again for giving me the opportunity to introduce you to what we are doing. We at CareDX, we focus on transplantation. Transplantation is all what we do. Here on this picture, you're not only seeing the transplant recipient, but you also see the transplant donor as well as the primary caregiver. We at CareDX care deeply for the entire transplant ecosystem. We come to work every day to focus on transplantation. And so here you see on this picture the executive team at CareDX that even in COVID-19 was leaning in and caring for more transplant patients every day. We at CareDX are focusing on the pre-transplant side, where we're helping patients on the wait list. We also match organs and recipients with our blood-based diagnostic tests. And then after transplantation, we care for patients with our surveillance tools. We're the leader in liquid biopsy offering called AlloSure, and I'll tell you a little bit more about this in a minute. And we also apply artificial intelligence solution, constantly driving and pushing innovation in transplantation. We are helping transplant centers to manage their electronic medical records with our Otter offering, and then also on their quality management side with our XynCopy offering. So with many transplant centers, we are helping them on constantly improving their quality management systems. CareDX, in terms of our history, we came from heart transplantation with AlloMap, a very single product focused company, a strong dedication to the heart transplant community, but then branched out and built a multi-product offering with AlloSure and AlloMap and kidney care. We are now a leader in multimodality testing, meaning that we have multiple solutions for various transplant patients and transplant settings. And we have built a very strong platform. In a way, we're kind of the leader in transplantation now when you're thinking about which company is entirely dedicated at the transplant continuum. So CareDX is a very strong platform with a very bright future, as transplantation is something in medicine that will continue to grow in the future. We at CareDX have a very strong dedication on improving long-term outcomes. We have a model where with our solutions on immune modulation, compliance and adherence, and also on the focus on standardization and individualization, we have the aspiration to improve long-term graft survival from 10 to 13 years. And with our solutions that you see here at the bottom of the page, like the trials and the products and services that we are having first promising successes in really making that happen in the future. Now, to make it maybe a little bit more simple, it is better data and more engagement will lead to better outcomes. And how we're doing that, I'm focusing on now in the next part of this presentation. With AlloSure and AlloMap, we're measuring the health of the organ and the recipient. These are blood-based diagnostic solutions that allow clinicians and caregivers to make better decisions if the health of the organ is established, or maybe they need to change immune suppressive therapy, or maybe have to see you more or less often as a transplant patient. So AlloSure and AlloMap are very strong solutions to measure the health of the organ and the recipient. With AlloSure, AlloSure is a blood-based diagnostic test that is less invasive and much more accurate than the current standard of care. With AlloSure, we have now cared for more than 25,000 kidney transplant patients in the United States in the last 3 years. So this has been widely adopted in 180 transplant centers in the country, which basically means we have full coverage across all states, across all geographies with AlloSure. What is actually AlloSure doing? AlloSure is a validated donor-derived cell-free DNA test. That means basically we are measuring the cell fragments from the transplanted organ in the bloodstream of the recipient. very simply said, if there are a lot of fragments, there's probably an injury occurring. If there's very little fragments from the organ floating in the bloodstream of the recipient, everything is okay. So we have a very, very high negative predictive value, which means that we can actually measure the health of the transplanted organ with AlloSure. But we're not stopping here. Our concept of kidney care adds AlloSure, which you see on the left-hand side of that chart, and adds AlloMap, which is an immune modulation marker. So AlloMap is a gene expression profiling technology, which we are pushing forward and wanting to make available for transplant patients as well. With iBox, this is where the artificial intelligence and the augmented intelligence in transplantation comes under the umbrella. And we also have research and development efforts with HistoMap and EuroMap, two additional markers that will allow us to not only inform blood-based information, but also have urine-based information as well as tissue-based information, which means biopsy results, more intelligently interrogated and make that available to the caregiver. So kidney care is basically a much more holistic multimodality test that gives the clinician and the caregiver multiple data points to make a good decision on the way forward for transplant patients. Now, transplant patients are very important in that continuum, so having more engagement and better engagement through our patient engagement platform, which we call AlloCare, is tremendously important. And how do we bring that and make that available to our transplant community is through a very simple app. On this chart, you see that this AlloCare Transplant app is a smartphone app that helps remembering appointments, track and monitor medication adherence, measure health activity, and maybe build a stronger community within transplant patients and transplant recipients. So with this, we at Spire, we just launched this product or this phone app. It is now available on the Apple Store. It will soon be available also on the Android platform. But we try to engage transplant patients with this patient app, and we're so excited that many patients have already done so and do track their results on a daily basis with AlloCare. Now, COVID-19 is obviously a key challenge for many of us. And when we learned about COVID-19 and the worries of transplant patients, we made home-based testing solutions available to the transplant community. Almost half of our blood draws were actually done in the home of the patient, which is truly amazing. 150 centers, more than 4,000 patients already on the platform. So RemoTrack, which was our solution to home-based blood draws, has been really widely adopted again in the United States. So if you need a blood draw, call CareDX and sign up at RemoTrack. We help to make that mobile phlebotomy available to you. Now let me pivot into what is also very important working for the transplant community. We want to make sure that also policy is following our dedication in the field. So in a way, CareDX is punching a bit above its weight when we're thinking about transplant policy. And we think we want to be an employer that sets examples. No patient should have a disincentive, or no individual should have a disincentive that participates in organ donation. With our leader policy, living donor employee recovery policy, we are making sure that no employee that is giving an organ is having any misincentives to do so. And I think this was widely adopted and got a lot of kudos from the transplant community, because CareDX is stepping up as an employer and making sure that we do that statement. And if you here on this, see this, and you are employed by a company, make sure that they also have a policy in place that removes disincentives for donation in your employer as well. We're also, I think now that we moved on from the leader policy, now going over to ImmunoBill, this has been a national patient-centered campaign where CareDX offers support through Honor the Gift. We focus on extending the Medicare coverage of immune suppressive medication for kidney transplant recipients beyond the current 3-year gap. This has been tried many times before, and we are putting all our passion and all our energy and all our force behind a tremendous group of companies, organizations, and efforts to really make this year the ImmunoBill happening. Now, donor to donor has been a strong partner in that, and kudos to the team from that and so on that really are helping us to move this over the finish line. We're together with 31 other organizations, now 32 partners actually, that are helping us to move the immunobill and make that a reality. If you have the chance, go on Honor the Gift, Google Honor the Gift, and sign up and send a letter to your representative, making sure that we are getting broad-based support on that. Now, to learn more about CareDX, please visit caredx.com or contact us at customercare@caredx.com. And thank you very much for you being a living kidney donors. We'll continue to support the policies and continue to support you, the transplant community. Thank you very much, and bye-bye now. Hello, my name is Peter Maag, and I would like to tell you more about CareDX. CareDX is proud to be the presenting sponsor of the National Kidney Donor Advocate Conference. We would like to thank Donor to Donor for this amazing opportunity to show our support and appreciation for living kidney donors. I cannot express enough thanks for your selfless act. Thank you, thank you, thank you.